brunch. Sunday, bottomless brunch with Trey after. Yes, Liv's coming. I know the perfect place. Oh, including. Yeah.
Okay, waiting for players. Waiting for players.
I'm just gonna go into it. Nice. Tearing apart your body. Oh, hold on, I'm not in. Are we almost? Yeah. Probably. I have a feeling that we all stay together. Yeah. Yep. Okay. Where is I think she's going to. No, I don't say anything because Lauren hasn't seen it yet. Huh? Oh, God. How long did you guys live? Okay, that's not bad. What? Oh, they were like, text me when you get home, please. I didn't know that you were safe. You literally didn't even read my message. I feel like I'm going to
The number is like going backwards. It was like at 23, now it's at 19. Do you guys just get kicked out? Is that what happens? It gets, if it doesn't start. So we should have like 27. So we should have like 27 people in there. So who's not in there? It's okay. So hurry and log in so we can get started. Okay, first question. We're up. What the body does is, in response to a drug is called. What the body does in response to a drug is called. Pharmacokinetics. And then remember, so think about like movement, so how your body handles the drug. That's the pharmacokinetics. And the pharmacodynamics is what the drug is doing to your body. Yeah. So one is how the drug moves around, the other is what the drug does to your body. Absorption, distribution, metabolism, excretion are all phases of which one? Pharmacokinetics, good. So all of those components, like what your body does with it, that's all pharmacokinetics. So the absorption, the metabolism, how it kind of goes through the liver, becomes metabolized, all of that is pharmacokinetics. So, and those are the four main parts of pharmacokinetics. So that's what you'll want to review that when it comes time. And there's a little bit of that in here, just to help bring it back to your memory. The official name of the drug used by all manufacturers of a particular drug. So the official name, brand, generic, chemical. Good. Yeah, generic. So that the kind of key there is all manufacturers. So if it's the proprietary or the trade, that is the one that's the name for just the company. Oh my goodness, you guys. So maybe I'll do no commentary. I'm going to do no commentary. Then I don't have to fight. I'm not going to do any commentary. I'm going to be a mouse. Well, I would think it would help, but I'm fighting. Time required for a drug serum concentration to decrease by 50%. Tolerance. Okay, just forgive my misspelling. It was a very fast. I did it there. Lola was taking a nap and I was like, I gotta. There's probably a bunch of misspellings. Okay, halftime. Yes. Good job. Oh my gosh. Yes. Very good. It probably should be halftime. It was the Super Bowl. It was the Super Bowl. Yeah, no, it is half-life. It's half-life. I didn't even realize it when I looked at it. I'm like, halftime, that sounds good. No, it's half-life. There's going to be probably many funny oopsies in this Kahoot. Okay. But I'll try and clarify them as we go. Thank you, Miranda. It is half-life. Okay, a drug given by a parenteral route. Remember, there's topical, enteral, parenteral. Injected, yeah. So that's like subcutaneous, that's intravenous, that's into the muscle or into the dermis. So that's anything that's pretty much given an epidural. So that's anything that's given by a needle is parenteral. An adverse reaction that is predictable and has a dose, did I misspell dose? Related effect on the target organ is, so it's predictable and it's dose related. Toxic, good, yeah. So if it's allergic, you could give just like the teeny tiniest smidge. It's not dose related, they're just allergic to it. Idiosyncratic would be more like on purpose, maybe, like a mistake by the practitioner. And then, or it could be genetic too, genetic changes. And then side effect is just anything that's a side effect. It can be GI upset, it could, so it could be anything like that. So toxic reaction is the one that's predictable. You're only supposed to give such a dose. If you give more than that, then it can be toxic. Yeah. Say it a little louder. Yeah, well, they kind of almost, a side effect can be any kind of an adverse reaction, really. So they sort of are a little bit. like a side effect goes under the adverse reaction. So all of these are kind of adverse reactions. So side effect might be more like, xerostomia is a side effect, and it may or may not be predictable because some people have them and some people don't. But a toxic reaction, if you like, it's dose related, so you can kind of predict this will happen if we give too much. Drugs are typically metabolized in the which organ? Oh my word, there's so many misspellings. It's so embarrassing. Well, they're kind knees. Okay, the liver, very good. I'm so fixing this right when I go into my office. I'm gonna fix this. It's so bad. Like, I don't know. I just give up sometimes. Okay, a drug is mainly excreted from the liver, kidneys, hypothalamus. I spelled hypothalamus right, but I can't spell kidneys, spleen. There's a consistency in my misspelling. Yes, good, very good. Okay, constriction of smooth muscles and blood vessels. So vasoconstriction occurs on what receptor? I know this is like, who knows? Who remembers these?
I'm gonna go with it.
Vasoconstriction. Think local anesthesia. Think local anesthesia. Probably too late now. Oh, I pressed the button before I meant to. Sorry, I should have gone back to it. But so alpha one is the constriction of your blood vessels, so vasoconstriction. So think about when we're giving local anesthetic, there is some beta, local anesthetic does affect some beta receptors, but it has more of an affinity to local anesthetic. And so that's to alpha one. So that's why you get the vasoconstriction in the area that you're anesthetizing, is because they're working on alpha one receptors stronger than beta receptors. Stimulation of the heart, increased heart rate, increased contractility occur on what receptor? Alpha 1, alpha 2, beta 1, beta 2. Yeah, that's kind of a little not sure area. So beta 1, remember you have one heart, two lungs. So a lot of stuff that have to do with contraction or the heart muscle is going to be beta 1. One heart, two lungs. Relaxation of smooth muscles, blood vessel dilation of smooth muscles, bronchodilation occurs on what receptor? Good, yeah, beta 2. So beta 1, heart muscle, beta 2, you can think of like the bronchodilators tend to work on the beta 2. So we always, that's why it's one heart, two lungs. A beta 2 agonist would be useful in treating what condition? A beta 2 agonist. Asthma, good. Yep. So it's going to dilate. So I'll probably be information maybe for a next questioner, I'm not sure, I can never remember, but agonists, they kind of encourage whatever that receptor does naturally. Antagonist is a blocker. So antagonist block. A drug that has an affinity for a receptor site and binds to it, producing an effect, is called it has an affinity and it produces an effect. Agonist, right? So if it blocks an effect, I mean, you could technically say blocking is an effect because it's blocking, but if it blocks the effect, it's an antagonist. Okay, hypertension medications that end in alol are called OLOL. Good, yeah, beta adrenergic blockers are the alols. Calcium channel blockers are the penes or the pines. I think angioreceptor blockers are not statins. What's the other one? Sartans, that's what I was trying to think of. And then ACE inhibitors are Pril, angiotensin. Yeah, oh, that's a good one, ACE Pril. So angiotensin converting enzymes are Pril. So it's probably good to memorize all those endings. What do they call that? The word is suffixes. That's what I was thinking. I'm like, what's the word? Suffix. Neurotransmitter found in both the SANS, so that's the sympathetic autonomic nervous system, and PANS, parasympathetic autonomic nervous system, is which of the following? Epinephrine, acetylcholine. So which one is found in both? Good. Acetylcholine is in both. Epinephrine's only in the sympathetic autonomic nervous system. An example of an anticholinergic effect would be too much saliva, diarrhea, dry eyes, frequent urination. Anticholinergic effect. Good, yeah, dry eyes. So remember the guy, the guest speaker, he's like, you know, you can't spit, can't see, can't pee, can't poo. So those are anticholinergics. You have a reduction in basically like fluidy stuff. So a cholinergic medication or a medication that causes cholinergic effects would be rarely used, a medication to induce salivation. It's not very common, but there's a few medications that work on that. So anticholinergic would be the opposite of that. Everything's dry. Slud, yeah. Although in the review book, they used slud as almost like a cholinergic. So I think you could remember it either way, as long as you know that anti would be a reduction. Yeah, because in the review book that I was looking at, they were like cholinergic effects are extra salivation, watery eyes, and increased urination. So they used it opposite. But so as long as you know that anti for that acronym is decreased. Yeah, I guess. Yeah, but I feel like the only other time I've looked at and saw anticholinergic, they've referred to that acronym. So it was a weird, I was like, why are they saying it opposite? But it might have just been the way that review, I don't know. But yeah, as long as you know that that's all decreased for anticholinergic effects. Because most drugs do have, like, they're more commonly to have anticholinergic than cholinergic effects. Okay, muscarinic and nicotinic receptors are part of which branch of the autonomic nervous system? Sympathetic or parasympathetic? Parasympathetic, yep. So the alpha and the beta, that's all sympathetic. So alpha 1, alpha 2, beta 1, beta, that's all sympathetic, muscarinic, nicotinic. And you'll notice that most of the drugs that we talk about and or that is reviewed in oral med, most of them, I think, in certain categories, work on more like the sympathetic receptors than the parasympathetic. Okay, something that kills bacteria is called bacteriostatic, bactericidal, antimicrobial, anti-infective. And this is a little bit confusing, but it's per the definition in the book specifically. There's just like slight variations in definitions for the other ones. Good, but you guys are just so smart, you knew it. So good. Yeah, bacteriostatic is obviously kind of like a slowing or slowing the replication. And then there were other definitions for antimicrobial and anti-infective, which may even vary per the text. But if it's killing bacteria, it's bactericidal. Pretty specific. If an antibiotic is referred to as having a broad spectrum, this means it acts on many organisms, the organisms are unaffected, or it acts on few organisms. Good, yes, that was an easy one for you guys. Prevention of a potential infection is called treatment or prophylaxis. It's kind of interesting, huh? Because we think about it so often as we're doing a prophy, but that's actually what it means is you're preventing infection. That's like the definition of what you're doing. Of course, they're referring to it in like a prophylaxis of antibiotics. They're trying to prevent endocarditis, but it all sort of applies to the same broader meaning, really, prevention of infection. Okay, which antibiotics should not be taken with antacids or dairy products? Oh. I think I misspelled penicillin.
Yeah.
Yeah. I'm seeing it now that I'm looking. Oh. Tetracycline is correct. Yep. So tetracycline. So it has something to do with the binding. Fluoride? Oh, because it binds it too. Mm-hmm. Mm-hmm. Or if they OD, like if they eat toothpaste and you give them milk, maybe it's a good thing. Instead of fluoride. Well, that's my worst nightmare right there. That's so terrible. That's so scary. That can happen. Yep. Hey, that's why it's a good thing for everybody to have like a pill book that has the picture and description of your pill and double check your pharmacist. Everyone needs a backup. Everyone needs a double check. Okay, tuberculosis treatment can take up to how many months to complete? So 6 to 9 months. So it can be done in 6, but up to 9 months to complete. So 6 to 9 months. So good. Which of the following drugs can result in a severe drug interaction with alcohol? House bunny?
House bunny? Have you ever seen the movie
No,
House Bunny?
I don't think so.
I'm allergic to erythromycin. So it makes me
Metronidazole. Good job, you guys. So yeah, that can make them really sick, really nauseous, really sick. So they say to avoid like everything, like even mouthwash for I don't know reasons, like someone happens to drink it or something. Okay, local anesthesia is contraindicated in patients with uncontrolled cardiovascular disease. I don't know if this will be different than what you guys learned in
Think about it, you
local
guys.
anesthesia.
Think about it. Yeah, we already passed it. It's okay. Oh wait, what?
Is that different from what you guys were taught?
The word local anesthesia is
So the key term is uncontrolled. So really, like the studies and stuff say it's very safe. You don't have to worry. But if you have a patient that comes in with uncontrolled heart disease, typically you would avoid epinephrine. You would avoid local anesthetic.
local anesthesia is
Because you're thinking of like the actual local anesthesia. You're thinking about the anesthesia, not the epinephrine. The epinephrine, yeah.
Guys, is it contraindicated for both then?
I think that they're probably, because local anesthesia has a natural vasodilating effect.
Yeah.
And like a lowering of blood pressure. So I'm assuming that when they are talking about this in the review, they're probably specifying epinephrine,
Okay.
is what I'm assuming.
Okay.
And so I was kind of curious about, because I know in different classes, maybe that's been focused on differently.
Yeah.
So that's what I'm thinking, because a lot of times they'll say someone with cardiac disease or anything, diabetes, like, maybe uncontrolled diabetes or, hypothyroidism, uncontrolled hypothyroidism. Those are some of the conditions, but usually it's like 2 carps is okay, even if epinephrine, because it just doesn't, it's endogenous, it's in us anyways. But if they're really uncontrolled, it's probably better to avoid the epinephrine. So I think that's probably what they're focusing on. I don't know if on the board they would just say local anesthesia or if they'd say local anesthesia with epinephrine to kind of clarify.
I would hope that they would.
Yeah, I'm really not sure. The way in the review, it didn't really kind of draw that out, but
I don't think they would.
because it's so common to give it with epi. Yeah.
That's like kind of the general standard of care because it also provides human basis. So I don't know. I feel like on the board they were very specific about whether or not it had like.
Olivia.
I feel like it'd also be easier but they're at least
It's a pretty sick patient probably. So you're right. There's not a lot that you'll see like that.
when something like that is the best option, we always do or we discuss but the national board is going to be more generalized because
Oh, right.
so it's just
On the local anesthesia board, they might be more specific, but the national board might not be. Yeah.
But I remember saying if you have
Yeah. Yeah. It's. Yeah. And it's true. It's safer really to give it with epinephrine because, like you said, it keeps it in the area. It keeps it out of the bloodstream. And you can give, I mean, we have the 3 for the mepivacaine. Yeah. Dose related. It's probably something you'd consult with the dentist. Like you'd take their blood pressure and their pulse and you look at their history and they might tell you like, we're having trouble controlling my congestive heart failure or whatever it is, my cardiovascular disease or whatever it is. And then you just consult with the dentist. But if you feel like this is a really sick patient and I'm uncomfortable, it's really important to tell the dentist that, I think, and not just necessarily leave it to them, but definitely good to consult or call the cardiologist too. That's a good one. Okay. Patients should be warned that an acute overdose with acetaminophen can result in damage to what organ? Acetaminophen. Oh, look, I spelled kidneys right. I know, I should have kept it kidneys for all of them. Liver, right, yep. So then what's the other one? What affects the kidneys? What common pain med affects?
NSAIDs.
NSAIDs, yep, ibuprofen, yep, that affects the kidneys, acetaminophen, the liver. Adverse reaction of this medication can severely affect the GI, including discomfort, anywhere from discomfort to ulcers, like there can be somewhere in that spectrum. And I know a lot of medications can do this, so that's probably, but of these, which one would be the most common to affect the GI? The kidneys. NSAIDs, good, yep. So like even like long-term like bleeding or which might go along with ulcers, but NSAIDs can affect the GI quite a bit. I know. I think a lot of problems. Yeah, I think people overuse some of it because it's so common and we have pain. And so it's just like, oh, just take it. Okay, H2 blockers such as Pepsid AC work to do what in the stomach? Good, that was a good one. Yeah, so the H2 receptors, you know, have a lot to do with the production of hydrochloric acid or the stomach acid. So when you block them, you reduce stomach acid. Okay. Osteonecrosis of the jaw is reported in patients taking bisphosphonates that have been injected versus taken orally. I was running out of like allowable letters, so this was a hard one to write. But so if somebody's been taking bisphosphonates and they experience ONJ, was that from injected or orally? Yep. So generally, I think there are a few cases where it was from oral, but mostly that happens when people have been taken IV bisphosphonates. And I remember there was a question about the blood supply, and then on the review, it talked about poor turnover, of the bones. So I guess it's like, I don't know, I wanted to read more about that because I was like, well, that's what I was thinking originally was the turnover of the bone cells, but then losing a blood supply obviously makes sense why you'd have necrosis as well. So I think it's both, I guess. But okay, good. So injected is the higher risk, much, much, much higher risk. A drug that reduces nausea and vomiting is called an antacid, laxative, antiemetic, antipsychotic. Good, yeah, antiemetic. And isn't it like emesis? Isn't that vomiting? Like that, I don't know, that word is in my head. Maybe I just made it up. Okay, last one, Prozac, Zoloft, Paxil, and Celexa are all what type of antidepressant? Yeah, selective. So it's a selective serotonin reuptake inhibitor. Okay. SSRI. Okay, good. So we'll see the results and then I'm just gonna pull over the Moodle page just to show you what else is there. I won last time and I got second place this time. Caitlin, good job. Okay, very good. Good job, you guys. So let me just pull this over here real quick just to show you. So here's the video that I made last year when we, for the last year seniors when we had to do it over Zoom. I haven't listened to it. It was my first year teaching it. I'm still rusty, so it could be a nightmare. But maybe it has some helpful bits. So listen to it if you would. And then the PowerPoint there is, I just tried to pull in medications and just things that I really thought were pertinent. So there's about 78 slides. So download that for a later date when you feel like really diving into oral med. Then there's the Kahoot review that we just did, so you can replay it. And then there's this poll everywhere, which, like I said, has some good questions, but I don't know where the answers are. So I might be able to try and figure out the answers and then post an answer key at some point before the semester is over. I'm sure I can do that to be helpful. So, okay, so that's it. Okay, you guys, good, great job. You're welcome. And I'll see you again for special needs in a couple weeks. We'll do our,
This is why I'm confused.
Oh, yes.
So when I go on, this is my student RDH.
Yeah.
So it talks about absolute contraindications. And so that for local anesthetic,